Welcome to this explainer. Millions of people just kind of accept living with this persistent, nagging problem every single day. Foot, knee, and hip pain. It's a massive issue that can severely limit a person's mobility and just generally drag down their quality of life. But today, we're objectively breaking down the biomechanics behind this chronic pain, and we're exploring modern clinical solutions, specifically custom orthotics, that are actually designed to optimize foot health right from the ground up. In this explainer, we've got a solid agenda. We're going to cover 1. The root of foot pain. 2. What are custom orthotics? 3. Custom versus off-the-shelf inserts. 4. The 3D scanning process. 5. Benefits and lasting relief. And finally, 6. An overview of Northwest Rehab Group.
All right, starting off with Section 1, the root of foot pain and understanding the anatomical domino effect. Let's dive in.
So, you might be wondering, how exactly do foot mechanics affect the entire body? Well, it makes a lot of sense when you realize the human body operates as a complex kinetic chain. This essentially means that an issue at the very base, the feet, inevitably travels upward. If one part of a person's body isn't functioning properly, it forcefully changes the mechanics of the rest. That ankle pain, knee pain, or even hip discomfort, it can very often be traced right back to subtle irregularities in how an individual's foot strikes the ground.
A really common biomechanical fault we see is over-pronation. By definition, this is the rolling outward of the foot, which indicates improper alignment and poor biomechanics. When an individual overpronates, it's basically like the structural foundation of their body just shifts out of place. This misalignment creates intense stress points all over the skeletal structure, forcing joints and muscles to overcompensate with literally every single step a person takes. Now, what actually triggers this? Common causes of this painful discomfort include traumatic events, say a car accident, or ongoing issues like repetitive stress. Even poor footwear choices, like wearing high heels, play a massive role. Add in sports injuries or underlying medical conditions, and it becomes pretty clear that both everyday environmental factors and unexpected traumas can severely compromise an individual's biomechanical foundation. Moving right along to Section 2. What are custom orthotics? The targeted solution. Getting a firm handle on what this clinical intervention actually entails is absolutely crucial. Custom orthotics are specially designed prescription shoe inserts tailored to an individual's exact foot shape and biomechanics to improve structural alignment. Now, to be clear, these are not just extra foam padding you'd buy at a pharmacy. They are highly tailored medical devices. They're expertly engineered to mold perfectly to both a patient's feet and their shoes, actively correcting those underlying biomechanical abnormalities we just examined. The clinical applications for these targeted devices are actually quite extensive. Patients utilize custom orthotics to alleviate a whole host of specific medical conditions. We're talking about things like plantar fasciitis, flat feet, fallen arches, and persistent heel pain. Furthermore, because of that kinetic chain effect we talked about earlier, they effectively treat upward knee and hip discomfort. They even provide essential cushioning and support for patients suffering from the specific foot discomfort associated with diabetic neuropathy.
Next up is Section 3, Custom versus Off-the-Shelf, Understanding the Difference.
This comparison is a real game changer for anyone seeking lasting relief. On one side, you have custom-made orthotics, which are tailored precisely to an individual's exact biomechanical needs and unique foot shape. On the other side, you've got off-the-shelf inserts. Those rely on a completely generic design that fundamentally lacks specific biomechanical alignment. While a store-bought insert might give you some temporary cushioning, it inherently fails to address the specific structural anomalies of an individual patient's foot. Custom orthotics provide the advanced, individualized engineering required to physically correct mechanics. Let's look at Section 4. The 3D scanning process, advanced technological care. So what does the clinical procedure actually look like for a patient? It involves 3 distinct steps. Step 1 is a comprehensive biomechanical examination to deeply assess the patient's physical structure. Step 2 is a digital gait scan analysis. And Step 3 utilizes the absolute latest 3D scanning of the foot's contours. Modern clinical technology allows providers to capture highly accurate information covering all aspects of the foot, totally surpassing older methods that only measured the sole. A completely critical component of this process is the dynamic gait scan analysis. It provides a digital evaluation of an individual's walking pattern to pinpoint subtle structural abnormalities. You see, examining a foot while a patient is standing completely stationary is one thing, but analyzing a moving foot yields critical dynamic data.
This ensures the resulting orthotic actively corrects the patient's mechanics while they are actually in motion, addressing the faults that a simple static exam might completely miss.
On to Section 5, Benefits and Lasting Relief, Changing the Kinetic Chain.
The long-term physiological outcomes here are profound. The key biomechanical benefits include proper alignment and arch support and even distribution of body weight and optimal shock absorption. When you put all of those together, it leads directly to drastically reduced stress on the joints and vastly improved overall mobility. By systematically correcting the body's foundation, patients experience lasting relief from chronic joint pain, profoundly enhancing their daily quality of life and allowing for pain-free, balanced movement.
Finally, Section 6, Northwest Rehab Group Overview, Accessing Care in Vancouver.
For any individuals out in British Columbia seeking this exact level of care, the source specifically highlights Northwest Rehab Group. They are located at 2830 Main Street in Vancouver. This specific clinic is fully equipped with the state-of-the-art 3D technology we just reviewed, and they are highly dedicated to helping patients achieve optimal foot health through these specialized custom orthotic solutions.
Now, regarding transparency in healthcare access, the cost for the custom orthotic fitting and scanning at this Vancouver clinic is listed at $400. It's carefully noted that patients should consult their insurance providers directly to determine potential coverage, as well as to check whether a medical doctor's letter is required prior to booking their appointment.
To wrap up this explainer, I want to leave you with a rather provocative final thought regarding preventative care. Correcting your body's foundation early can prevent a lifetime of compounding joint complications. When an individual addresses biomechanical imbalances at the very source, the feet, they aren't just treating today's heel or arch pain. They are fundamentally protecting their knees, their hips, and their entire skeletal structure for the future. It truly goes to show how absolutely vital optimal foot health is to the entire human machine. Thanks for joining us for this explainer.